To the chairperson of the COVID-19 National Vaccine Task Force, Dr. Willis Ahwale, was also present among other ministry officials just to receive that consignment from the Danish government, a donation under Denmark's National Vaccine Surplus Program. I will take it back to Dr. Githinji Gitahi. You're talking about solidarity and the calls for vaccine equity across the globe. Looking at these, latest moves by some of these countries like Denmark, and bearing in mind just the other day, South Sudan was donating to Kenya because of the challenges of redistributing these vaccines. What needs to happen then that we don't waste this precious commodity?
One of the things I'm very proud of is the Kenya National Immunization Program. Kenya does vaccinate children, every year round on normal under 5 vaccines. And this infrastructure and logistical capacity which exists is what has actually enabled us to have a 99.9%, 99.6% absorption of the vaccines. Because the distribution channels for the COVID vaccine and the administration processes are not different from the ones we use for under 5 vaccination. And this is also the same one that's going to help us to absorb these doses. So I expect, based on the demand I have had people calling me a kissa saying, is AMREF administering? Where can we get the vaccines? So I don't expect that 360,000 doses will take us more than 3 weeks to administer because of that demand. The question is, how rapidly can we administer the ones we expect to see in August, the J&J, in a short time so that we save lives? And how can we also make sure that the government negotiates more bilateral deals with countries and also from the COVAX to ensure that all the people who've received AstraZeneca initially, about 1 million of them, receive the second dose. So already out of the million, about 200,000 have received. So we have 800,000 to go. We have 360,000 that has come. That means we have another 440,000. So that is the gap we must scale up very quickly because we have the window of the 12 weeks as we wait for the others to come. But remember, we have a wave that's expected to come in July, August, and it's likely to be driven by the Delta variant, which means that we need to actually accelerate vaccination, especially of those at high risk of hospitalization. We have no time to waste.
Should we be worried about the Delta virus and whether the vaccine actually is effective when it comes to this particular strain? There have been concerns around that.
There should be no concern. The data that we have from people who are administering AstraZeneca and who have the Delta variant, that's the UK. The UK, by the way, the Delta variant now is almost 80% of all the circulating viruses there and replace the original variant they had. But what has been seen from various studies is that 2 doses of AstraZeneca protect against hospitalization up to 92%. So we should be confident that the AstraZeneca vaccine, while received in 2 doses as advised, is protective against hospitalization. And therefore, we should actually encourage those people, when their chance comes, to receive it without any skepticism or any hesitancy. People were very hesitant originally, and they say people who receive vaccines will grow horns, will do this and this. Some of us are witnesses. We have actually received the vaccine. We have 1 million Kenyans who received vaccines. We do not have people complaining of challenges post-vaccination. So we want to encourage Kenyans that vaccines are protective, and AstraZeneca 2 doses are protective against even the new variants, and people should feel free, confident, and encouraged to be vaccinated.
Dr. a very critical question here. About 190,000 Kenyans have so far been fully vaccinated, and we expect that this new consignment will also go to second doses, as we've talked about. How should they behave? Bearing in mind that in the US, we saw an advisory that if you have been fully vaccinated, you don't need to wear your mask. What should be the rallying call? How do we expect those who've been fully vaccinated to then behave?
So let us put it this way, that the US has reached a level to say they're close to herd immunity, meaning that the virus would find it very difficult to find somebody who is not already vaccinated because of the dilution factor. Kenya is not there yet. We are talking about 1.6%. We are talking about maybe approaching 2%. We are going to go 3, 4, 5%. So we still have a huge population of people at high risk who are not vaccinated. So remember, number 2, that the fact that you've been vaccinated doesn't mean that you can't harbor the virus. You may not proceed to severe disease or hospitalization because you're protected by the vaccine, but you can still harbor the virus and you can still transmit the virus. There is a lower chance that you can, but you still can. And therefore you have to think around other people who have not been as blessed or as lucky as you to actually get the vaccine. And therefore you wear your mask to protect them. However, scientifically, Akisa, we can say that if you are 2 people who are fully vaccinated and you're just the 2 of you in a room, then you may not need to wear your mask. If you have 5 people who are fully vaccinated by the 2 doses, then you may not need to wear your mask. But as soon as you break that barrier and you need to meet people who are not vaccinated, remember you may harbor the virus even if you have no symptoms, and it's possible for you to actually transmit it. So the advice is, if you're meeting people who are not vaccinated, or you're going to the public because there's no way of telling who is not vaccinated, please protect the others and wear your mask.
Finally, Daktari, at what point can Kenya say that it has significantly vaccinated its population?
We look forward to vaccinating at least 60% of our adult population. And if our adult population is about 25 million, then you can do the maths very quickly and see that that's achievable. We are looking at maybe 18 million adults, because right now we do not have vaccines for children, for under 18. So we are looking at scaling up to about 60% of the adult population, and maybe as we go along getting to 100%. But for now, 60% of the adult population would be a good target. And if we're talking about already vaccinating maybe about 1 million people with AstraZeneca, 2 doses, and receiving another 10 million of J&J, already we are more than 50% of our target. So I think that by mid next year, especially because also, Akisa, what we have seen with Europe and North America, whereas the supply of vaccines has been very scarce, as these countries reach what we may call vaccination saturation. And also remember that other new companies are starting to manufacture vaccines. So supply is also rapidly increasing, actually. Then we are going to reach a point where vaccines are not going to be a challenge anymore to access. And I expect that point to be somewhere by the beginning of next year. So by mid next year, we should be able to reach our target of vaccinating more than 60% of the adult population as we go towards 100% of the adult population. And we wait for science to provide us vaccines that are approved for children under 18 years.
Will this in any way reduce the cycle of waves that we keep seeing? We're now talking about a looming 4th wave. I imagine that there is a cycle that has been, you can note from the first wave to where we are now. How does vaccination, quote unquote, cure this?
So we have said that vaccination protects against hospitalization. And what we know that actually creates the challenge, even when we have these waves or surges, is hospitalization, and that overwhelms the health system, because a certain percentage of people require hospitalization, require oxygen, require critical care, and those become overwhelmed, and therefore you end up with unfortunate lockdowns or sub-lockdowns or whatever you may call them, to reduce the pressure on the health system. Now, if we vaccinate a critical mass of our population, as we are doing, then it means that we will have less and less of demand on the health system for hospitalization, which means, therefore, that we will not be too worried about the circulation of the virus. Remember also that vaccination, though vaccination does not necessarily neutralize the rate, the infection. It reduces rate of infection, but does not stop you from harboring the virus. It means that actually, the more you vaccinate, the more you reduce the rate of transmission, the more you reduce hospitalization, and the more we can return to normal both socially and economically. And we have seen that in Europe and North America. And we have seen that people who are vaccinated with their first dose have a less chance of hospitalization, and people who are vaccinated with their second dose has even a much, much lower chance of hospitalization, which is what we want to achieve.
Thank you very much for speaking to us tonight. Dr. Githinji Gitahi is the Global CEO, Amref Health Africa, just speaking to us as Kenya receives another consignment from the Danish government, about 360,000 doses of the AstraZeneca vaccine expected to be administered to those who've already received their first dose. Thank you, Dr. Githinji Gitahi. Let's take a quick break.